Hi children, welcome to English World. This is your Ramesh sir going to discuss with you another lovely lesson. First of all, let me ask you, my dear children, what is your dream of your life? What do you want to become? Oh, police, cricketer, radio jockey, anchor, actress, hero, sports personality, politician, central government employee or state government employee, collector, doctor. Oh, doctor. Yes, yeah. We're going to discuss about doctor. Okay, yeah. This lesson we have completed already Unit 1 and Unit 2, and we are going to learn today C reading of Unit 2. And this lesson is about an ancient, famous personality of India, and he is none other than Susruta. Okay, who is he? Susruta. Ancient means old. Surgery means what? What is the meaning of surgery? Surgery means, what is the meaning of surgery? Surgery means operation. What is the meaning of surgery? Surgery means operation. Surgery means operation. Okay, nowadays plastic surgery. So if somebody loses some skin and it gets damaged, from other part of the body they take the skin and they insert the skin there with the medicine and all that. So that is what we call as surgery. So let's learn. It was midnight when Susruta was awakened by a frantic knocking at the door. Okay, there was a sudden knocking at the door, and who got up? Susruta got up. Okay, so he heard suddenly a sound and he was awakened. When was the door got? When was the sound came from the door? During the midnight. What do people do? Midnight, they sleep. They will be in deep sleep. So when Susruta was in deep sleep, he heard a frantic knocking at the door. Who is out there? Immediately Susruta asked, who is out there? Okay, asked the aged doctor. What kind of doctor? Aged. He is an aged man. Aged man means old man. Many years he has. He is an aged doctor. Taking a lighted torch from its socket in the wall and approaching the door. So as he was going to open the door, he took his torchlight. Where was the torchlight? It was in its socket. Socket means a kind of cover where you keep your phone. You have a cover like the torchlight also had a cover, and it was kept on the wall. So he took that one and he started walking towards where? He started walking towards the door. I am a traveler, my revered Susruta. So by then Susruta is a well-known man. He is a respected man. That is what? Revered man. So I am a traveler. Who was the man knocking at the door? Yeah, why did he answer now? Because Susruta called out, who is out there? Because of that, Susruta is answering now. What did he answer? He answered, I am a traveler. My respected Susruta, was the anguished reply. Anguished means someone who is in need, someone who is in pain, someone who is not healthy. So anguished reply was there. A tragedy has befallen me. I need your help. A tragedy means something has happened to me. I am in great trouble. Tragedy, I am, some unwanted thing has happened to me and I am in great need. I am not in simple need. I am in great need. Dear Susruta, dear respected Susruta, please come and help me. I need your help. So he is seeking the help of Susruta. He is seeking the help of Susruta. Susruta opened the door. So when Susruta heard the voice of this traveler, what did he do? He opened the door. What he saw was a man kneeling before him. How was the man out of the door? He was kneeling down. He was not standing on his legs, but he was knelt down. He was kneeling down before him, tears flowing from his eyes and blood from his disfigured nose. So he was crying, literally he was kneeling down crying, and blood is oozing out from his nose. Lot of this nose is disfigured. He was wounded. He was hurt. He was damaged, and lot of blood was flowing out. Lot of blood was flowing out. Get up, my son. Come in, said Susruta. Everything will be all right. But be quiet now. Okay. So what did Susruta do? Did he close the door on his face? No. What did he do then? He said, in a gentle words, in a kind words, he said, my dear son, don't worry, all will be nice. Get up, come in. Everything will be all right. But be quiet now. Be silent. He led the stranger to a neat and clean room. To which room did he take him? Susruta took him to a neat and clean room with the surgical instruments on its walls. Okay, there were some operation tools, operation instruments were there, and they were all kept on the wall. He washed his face with water and the juice of the medicinal plant. So what kind of juice did he use to wash the face of the wounded man? Juice of a medicinal plant. He used a medicinal plant to wash his face. Whose face? The wounded personality's face. He then offered him a mug of wine and began preparing for the operation. And today, why did Susruta give wine? Wine, yes, that thing which is available in a kind of wine shop. Susruta gave him some wine so that he might get numbness and he would sleep, and the operation could be very easy. Today, what do the people do to do before doing the operation? What do the doctors do? They give anesthesia. What do they give? Anesthesia to lose the touch, to lose the skin touch. Is that very clear? We lose the skin touch. He washed his face with water and juice of a medicinal plant. He then offered him a mug of wine and began preparing for the operation. Okay. With a large leap of a creeper brought from the garden, he measured the size of the stranger's nose. So, Susruta, what did he do? He brought a long leaf from the forest and he measured the nose of this man. He measured the nose of this man. Okay. Taking a knife and forceps from the wall, he held them over a flame and cut a strip of flesh from the stranger's cheek. Okay, he measured it and he took the knife or surgical instruments and he cut from the cheek of this man some skin he has cut. Okay, the man moaned. The man immediately cried. Of course, if somebody try to cut, or if somebody cut your skin, do you not moan? Of course you moan, you cry. But the wine had numbed his senses. Yes, wine has numbed. Here in the hospital, anesthesia is given for numbing, for making the persons to feel loose. So before operation, what kind of injections are given today? Anesthesia. Who is the personality that we are discussing in the lesson? Susruta. Why did he open the door? Somebody knocked at his door. Who was he? A traveler. What happened to him? He was wounded. And what did he ask Mr. Susruta? He asked Susruta for help. Did Susruta allow him? Yes, he allowed him and brought him to a neat and clean room. Then what did he do? He bought a long leaf which is size of the nose of the traveler and made him to sleep. And what did he do? Before doing the operation, what did he give to the man? He gave him wine and cleaned his wound with the juice of a medicinal plant. Remember this. After bandaging the cut in the cheek, Susruta cautiously inserted 2 pipes into the stranger's nostrils and transplanted the flesh to the disfigured nose. Molding the flesh into shape, he dusted the nose with powder licorice, red sandalwood, and an extract of Indian barberry. He then enveloped the nose in cotton, sprinkled some refined oil of sesame on it, and finally put a bandage. Okay, how did he do the operation? You know, two pipes he put into the nostrils of the man. Then he actually made the flesh that was cut from the cheek into a fine shape of a nose, and then he put some sandalwood powder, some other forest related powder, and then some other juice was mixed up, and then by using cotton he bandaged the nose of the person. He bandaged the nose of the person. Is that very clear? Yes. And also he has used oil of sesame. Okay, exactly, correct. So if somebody asks you how did Sushruta, what was the process of operation, then you will have to write here that these are the answers. Is that okay? That is very, very important point, my dear children. Before the traveler left, he was given instructions on what to do and what not to do. Of course, even today doctors, if you are admitted in an hospital, what do? For next 6 weeks, don't eat non-veg, don't drink soft drinks, don't go out early in the mornings, take rest, do's and don'ts, right? Likewise, before the traveler left, what did Sushruta tell to the traveler? Some do's and don'ts, what to do and what not to do. A list of medicines and herbs he was to take regularly. So Sushruta told him about list of medicines and also some kind of plants, medicinal plants, which he has to take regularly. He was also asked to come back after a few weeks to be examined. As of course, as doctors do today, it was done much time ago by Sushruta. And after few weeks of taking these medicines and herbs, you please come back to see me so that I can examine your wound. In this manner, Sushruta mended a nose some 26 centuries ago. How many centuries ago? 26 centuries ago, the first plastic surgery was done by Sushruta, and he is an Indian. What he did is not greatly different from what a plastic surgeon would do today. It is almost same. 26 centuries back. What is a century? 100 years. Like that, 26 centuries. Just remember, my God, 2600 years back, the first plastic surgery was done. And how it is done today and how it was done so many years back is same. Sushruta is today recognized as the father of plastic surgery all over the world. So if they ask a question, who is the father of plastic surgery of the world, your answer should be Sushruta. Sushruta is the father of plastic surgery across the world. He has written a book, Sushruta Samhita, has considerable medicinal knowledge of relevance even today. So he has written a book called Sushruta Samhita, wherein lot of medicinal knowledge is incorporated in that. It indicates that India was far ahead of the rest of the world in medicinal knowledge. So this book and other incidences tells that India is much better than many other countries in the area of medicines. India began its knowledge of getting its works of medicine much earlier than all other countries, and today it is a different scenario. If anybody is having a kind of sickness, where do they go? America they go. They don't stay in India. They think that because Americans work realistically, but our fellows work for money. That is the difference. It indicates that India was far ahead of the rest of the world in medical knowledge. So Sushruta was born in the 6th century BC. Which century he was born? He was born in 6th century BC. Sushruta was a descendant of the Vedic sage Vishwamitra. So, who is the master of Susruta? Vishwamitra, and they all belong to Vedic period. In history, you might have come across this word, Vedic period. Vishwamitra was the master of Susruta. He learned surgery and medicine at the feet of Devadasa Dhanvatari, at the feet of Divodasa Dhanvantari. Divodasa Dhanvantari. So, this person Vishwamitra is a descendant, one of the family members of Susruta. But the guru, the master of Susruta was Divodasa Dhanvantari in his hermitage at Varanasi. In his hermitage means where sages, rishis live in. That place is called as hermitage. And Susruta and Divodasa Dhanvantari were from Varanasi. Where are they from? They were from Varanasi. Later he became an authority in not only surgery but also in other branches of medicine. So later on he not only he was into the surgery but he was also in other medicinal fields also. He has put his stamp. So Susruta worked for medicine for a very large number of time. Okay, for very much time he worked and he was in medicine. He was the first physician too. He was also the first doctor to advocate what is today known as the Caesarean operations. He was the first physician to advocate what is today known as the Caesarean operation. Where do the people use Caesarean operation? During the birth of a child they use this Caesarean operation. And even this is not a new thing. Even 2600 years ago it was done by Susruta. He was also an expert in removing urinary stones. Kidney stones we say, even those stones also he used to remove very easily. Locating and treating fractures, and when your bones get broken, even those also Susruta used to treat very nicely. He used to treat very, very nicely. Treating fractures and doing eye operations for cataract. Cataract is a kalakalakalu. Even such kind of sicknesses he used to treat very nicely. His suggestion to give wine to patients about to be operated upon makes him also the father of anesthesia. So he, before operation he was the one who actually used wine. Before nobody has used it. So he was the one who learned that if a person drinks wine, he loses concentration, he loses the pain, he loses the feel of the skin. So that's why he is also considered as father of anesthesia. He is the father of Caesarean operation. He is the father of plastic surgery. See, even bone fractures, other things also, he was the one who started mending them. Even cataract father, Susruta we can name him. So he was into medicinal field for many years, and he was the one who began all kinds of works in the medicine, my dear children. That is the thing you will have to remember. In his book, Susruta listed 101 types of instruments. For operation related, he almost mentioned in his book 101 instruments. 101 instruments. Is Samdamsa Yantras. Samdamsa Yantras are the first forms of the modern surgeon's spring forceps, dissection and dressing forceps. Okay, what are they? Operating, cutting and dressing forceps. These are the different types of medicines. When you want to cut, different tools they use. When they want to operate, some kind of tools they use. When they want to dress your wound, they use another type of things. So these are the different kinds of things, my dear children. In fact, is a system of naming surgical tools after the animals or birds they resemble in shape. So first, Susruta, how did he name the tools of this operation? According to the animals and birds, because these tools were in the shape of those animals. That's why he called these operating operatable, the tools that were used for operation, they were resembling and similar to some animals and birds. So he called these tools under the names of animals and birds. So how did he call them? Crocodile Proceps, Hawksbill Proceps is adopted even today. Even today also there are such kind of names. See, that is Crocodile Proceps. Proceps means knife. Okay, even today. Surshruta was also an excellent teacher. He was not only a doctor, children, he was also an excellent teacher. He was also an excellent teacher. He told his students, people means student, that one could become a good physician or a doctor only if one knew both theory and practice. How do you know that a person is a famous doctor? When he knows the knowledge of theory and practice. When a person has knowledge of theory and practice, then he can be called as a good doctor or a best doctor. He advised his peoples to use carcasses, dead bodies and models for practice before surgery. So, Sushrata, how did he advise? He told his students to use dead bodies and other models to do surgery, to do operation. So, this is all about. Whom did we discuss about? Surgery or Sushrata. Who is he? He is a great physician. He is not only a doctor, he is also a great teacher. What is the advice of him? That every person must have a good physician or a good doctor must have the knowledge of theory and practice. Who came to his house? A traveler. Why did he come? He was wounded. How did he operate him? He operated him by providing wine before the operation, and he cut some of the skin from his cheek and operated. And what were the advices given to him? That he must take some medicines daily, and then after few weeks he has to come back to see him. What were the different kinds of tools did he use? One at one. In where did he mention all these tools? In his Sushruta Samhita book he has. Where did he come from? He comes from Vishwamitra family. Where did he start his surgery and all kind of operational work? At Varanasi. Who is his guru? Devadasa Guru. Okay, these are some of the questions, my dear children. Hope the lesson is very clear for all of you. So, why did he call these tools? How did he call these tools? Mr. Sushruta called the operation tools in different type of names because they resembled like animals and birds. He called these tools under the name of a animal or a bird. Okay, what are the different types of operational instruments? There are different types of, some are for dissecting. Dissecting means cutting. For cutting, dressing, he used them. In which are the fields he hails and he stands as the father? He is the father of anesthesia. He is the father of plastic surgery. He is the father of caesarean operation. Hope children the lesson is very clear for all of you. We have discussed about the lesson Sushruta, an ancient plastic surgeon. Okay, hope the lesson is clear. Write the hard words and also question and answers, and if you have doubts please